Hi, everyone. Let me go
Hello, hello.
gallery view. Nice to see y'all. And more coming, I'm sure, by the moment. If anyone has a question that they want to ask about anything in the next minute or two while we're waiting for folks to join, anyone have any pressing questions they want to start with? Okay. Um, So I think we should probably continue to reward punctuality and stay on course, as this is our second to last in-person meeting, and we've been starting rather promptly, and thank you to all of you for joining promptly. Um, so um, Today we're going to have a working session. We're going to be reviewing your ideas that you have percolating so far for letters to the editor. So this is going to be a session that is going to be highly dependent on you and your questions and your thoughts, what kinds of issues you're running into and beginning to think about your letters to the editor. So that's what we're going to spend most of the time talking about today. And I think we should go ahead and leap into the little presentation that I wanted to do to start with about your letters to the editor. And then we'll morph into a discussion altogether. Yeah. So let me share my screen and um, okay, so you're seeing there, and I want to go to here and to here and to there. And one more adjustment. How do I get to full screen? Let's see. View, present. There we go. Okay, excellent. All right, I'm going to go ahead and launch in. So this is our 9th session, and we have one more in-person session to go. We're going to be talking today, like I said, about writing your letters to the editor, which is the last big assignment, and something that I hope that you will look to as your crowning achievement in this stage of development as a leader, as a leader in this leadership course. So just to review how it's framed in the course, this is, like I said, this is meant to be a reasonably heavy lift in terms of your time over the next few weeks as the last activity along with the final exam and any readings or quizzes that you haven't done yet. We've included a public health advocacy letter to the editor. I'll be walking you through one that I wrote in a moment. And I'd encourage you to look at, to think about letters to the editor that you've read in the past as models for what you might like to do with your approach. Um, so the second step here is the topic and the audience. So this can be, you can think about this in two different ways. You can think about this as a place to express your opinion about something in a professional context, or you can think about how to do so to a newspaper because, or magazine in your community, because you are all employed as government employees. This is something that will you'll be needing to think about in particular, and it's why we have a step in here about checking with your supervisor no matter where you publish it, because it will be perceived. sorry, I just want to make sure um, I, if folks could mute their Hangouts, their mics, if they could, if they're not wanting to chime in. Um, so the letter to the editor, the main thing to do is to just make sure that you follow the publisher's instructions for publications. Usually that puts it in at around 300 to 500 words. And then this is just on submitting it and peer reviewing it. As I mentioned, we have an extra step in here, whether you're submitting it for a professional publication or a lay publication, to make sure that you follow whatever the protocol is, since this will be a public declaration of an opinion on something that you think needs changing. So you might want to clear that as appropriate through your organization. All right, so I just want to show you first, and then, like I said, we're going to transition to talking about your thoughts on your letters to the editor and what kinds of approaches you're taking and questions that you have. So I'm going to show you a letter to the editor, which might appear to just be an opinion piece to you, but actually was a definitive declaration prior to being shortlisted as a journal editor. So, which I've done in the past. I was the editor-in-chief of Preventive Medicine for 5 years and the editor of the student part of JAMA for a year. But I was thinking about the Canadian Medical Association Journal, because CMAJ was about to come up with a need for a new editor, and I was on the editorial board and was interested in it, but I was only interested in it if we solved a big problem, as opposed to being just another journal. So I took, let me just see if I can move this out of our way a little more. Perhaps there we go. I took a fairly bold stance, and you want to bother writing a letter to the editor about something that matters. And you want to start with a hook that is as strong a hook as you can. And this is pretty bold. Here I said that unless we publish all competent research that we have as a society, that we've committed irreparable world scale malpractice, right? It's a really inflammatory language, which I, sheltered as an academician, can do, which you probably don't have the professional permission to do. So you want to think about your first sentence needs to be high enough octane to get your readers interested, but not imperil you professionally. This stance, as I was starting to tell you, really defined the approach that I took in applying for this job as the CMAJ editor. I knew that it would make or break me, and I knew that it would probably break me because CMAJ and the Canadian Medical Association had shown no inclination to do this, despite my having been on the board for a decade. But I wanted to show integrity of approach and to demonstrate that this is what I thought really mattered. So I went ahead anyway. So you want to start with a compelling hook, and then you want to flesh this out a little bit. Why does it matter? Much like the first paragraph of a manuscript of any kind. Why does it matter? If we don't publish it, the data perish, and if data perish, people suffer and perish as well. And taxpayer public investment evaporates. So that's the first paragraph. What's the problem? For the second piece of it, I set out the moral imperative. that this is something that we've got to do. We have the resources for it in Canada. If we don't step up and start publishing all the knowledge that is worthy of publication in the sciences, then it's really on us. It's really an ethical imperative to do this. And I started to introduce the idea of how one might actually do this. What if you set the bar at a different place? And then I got into, in the middle of the letter to the editor, um, I got into some specifics about how this might actually work so that people could see this isn't just some pie in the sky idea. This is real, and these are some strategies to actually make it happen. And then I talked about what are the potential downsides? So again, so that a reader knows that I'm not just coming up with this great idea, but haven't really considered the negative implications. And then I closed with recognizing explicitly the outrageousness of the notion that this is a real challenge, but emphasizing that I'm part of the publication establishment. As I said, I've been a journal editor and journal board member and was on the editorial advisory board where I proposed this. Um, so it made it clear that this is someone with credentials to make such a suggestion. Um, and again, closing with something that really is a call to action, that, we can't let our fiefdoms or our greed or inertia stop our ability to be able to democratize knowledge, a theme, of course, that you've heard from us quite a bit in this course. So that's what I wanted to show you. That's how I structure that kind of structure is how I structure most of my letters to the editor. Um, and now I think we're ready to dive into your questions and thoughts about what you're thinking about for your letters to the editor, and also questions that you have about approaching that. So, someone want to dive in with either their LTE topic or with a question?
Hi, good afternoon, everyone.
Hello, Alicia.
Hi. So, for my topic, what I had in mind was something. Well, I'm based in the chronic disease clinic, and one of our main things, which I keep talking about, which I keep highlighting, is that our center was one of the pilot centers for the Heart Initiative. So I was thinking to do something in terms of that, because at one of the last webinars that we had, actually, one of the things that stood out with me was that they were pointing out that, in the middle of the COVID pandemic, everybody is focusing on COVID, and somehow, our chronic diseases, or the other comorbidities, they get sort of pushed to the side. And one of the big things that we were doing is that we had done it in pilot centers with the plan that we would roll it out to all our primary care centers. But with COVID, it kind of got pushed back. So now it's still we're just really promoting it mostly at the pilot centers. So I was thinking that my letter to the editor could be to bring this back to the forefront. We actually collected some preliminary data which showed that our control rate had improved from 31% to 50%. So I could actually bring in local data that supports it, that we need to get back on track, to be aggressive, to start rolling this thing out, to making sure that the drugs are available in the pharmacies and so forth. And it's twofold. One is to actually roll it out, but also it's a standardized approach. So it's something that we trying to standardize the dual antihypertensive therapy. and standardize the drugs that are being provided. That way, we could increase patient compliance, we could increase accessibility to the medication. So, in the letter to the editor, by bringing that out to the forefront, it could help push that aspect of it along as well. And it's interesting how you brought up, like how you outlined in your letter. I was kind of trying to figure out how to say that, I have the, as I said, the credentials to comment on this. And I was thinking that in terms of that, I could say, well, I am at one of the pilot centers. So, and I have seen, and from the data in my patients, that it has actually made a big difference. So, from that perspective, I do sort of have the credentials to speak on the topic. Those are my thoughts so far.
Yeah. Yeah, you have both the credentials and you have the ability to tell a compelling story. And letters to the editor often have compelling stories in them, right? So
Right.
I think that's terrific. I also think that as a hook, something that's really been so frustrating to me as a specialist in preventive medicine is that we, the global preventive medicine public health community, have not effectively used the tragedy of COVID to really emphasize the role of comorbidities, and
Right.
that we've talked about this a little bit earlier, but I really think that this is a critical place for leadership. That, if you didn't care about your diabetes because of retinopathy, then maybe you'll care about it because of COVID comorbidity.
Oh,
Um,
yeah. Okay, yeah. That's a good point. I could really use that as my compelling opening, my hook.
yeah, I think I'm glad you like that as a hook too. Good. Nice. Others have comments on that or want to talk about some of their ideas?
Yes. Oh, can you see me? Yeah, I'd like to comment. I think that chronic diseases are very important. And I think what is significant would be to say how many people have died and been impacted by by chronic diseases over the many years. And yet the mandate and collaboration to address it has not taken on such an aggressive plan, such as COVID-19. So we are losing people. We're losing young people. Persons are being diagnosed with diabetes and hypertension at an earlier age, and loss of productivity. And it is disheartening to think that we waited for a pandemic to then, get up in arms and say, let's fight the COVID-19, let's fight NCDs. So I think, you really do have a compelling um, story, and that people with comorbidities are more impacted. So that's a double whammy. And so we need to respond. Um, but I also wanted to speak about the topic that I was going to talk about.
Good. Excellent.
And so I suppose I would start with we champion the cause of speaking about bending the curve and focusing on COVID-19. And the world has amassed monies and to address COVID-19. Some countries have been pretty progressive, others are not responsive, and that's a challenge. But one of the challenges that we have not addressed is addressing violence. And violence is as well an epidemic and pandemic throughout the world, taking many lives, particularly young people. In the Bahamas on March 17, 2020, when we did the proclamation of the national state of emergency, which caused several lockdowns. Between the first 2 months, we only had 20 incidences, according to the Royal Bahamas Police Force, of violence. And when we changed those made adjustments between May and September, we've had 239 incidents. So, violence is still an issue during the pandemic. And we know in particular for women and children who were previously at risk for abuse and gender-based violence, that they're even more at risk dealing with COVID. I think that there's a compelling need for us to look at that epidemic in our countries, to come together and address it. And I want to set out the imperative, just like we have taken the public health approach to addressing COVID, we need to take the public health approach to addressing violence and curing violence, and explain how, it is indeed not only the general public has responsibilities in addressing violence and the country at large, and things that we can do in terms of better communication relationships. The downside, if we don't, we lose the productivity of our population, particularly our young people. In particular for our country, when there's a high incidence of violence, people don't like to come and visit the Bahamas because they don't feel like they're safe. And that I have the credentials. I'm a public health leader. I have a master's in public health from Hopkins. I have youth development and prevention. And we have been trying in the Bahamas to address this, and it hasn't taken the political will that it needs to. And that is disheartening. So I call for action.
So what specifically, both for you, Callie, and for Alicia, what are you asking people to do? Because that's important. You want to rally the troops, and then you want to give them a task, right? It especially if you're writing for a lay audience. Like for me, this was sort of more of a policy declaration sent to journal editors and medical specialty societies that have journals. That was sort of the call to action there. Who do you want to do what?
Well, for me, I want the powers to be to get back on track and push the rolling out of the algorithm and the use of the algorithm, not just at the pilot centers, but also to all primary care centers. I want to push the people who, because it's a lot of it is based on access to the medication. So they have to make sure that the pharmacies have the medication, that they have them in good supply, because if the patients can't afford to purchase it, then they will fall off of it, and that affects the success of the treatment algorithm. And I also want to push the people, like patients, because I want them, part of this is based on the patient-centered approach. So we want to get all the patients on board to actively monitor, to take an interest in controlling your blood pressure and taking your medications and compliance with medications and all of that. So it's kind of like, I don't know if I could do three folds just to tackle it from all sides. I'm not just to people in public health to actually push it forward, but also to the patients to take an interest uh, in their own medical, status, and to try to get control from their perspective as well.
So you might want to think about two letters
Okay.
to two different audiences. Like maybe one is a letter to a magazine, but like maybe one is a call out box in one of your clinical newsletters, right? Because it sounds like you want to reach other clinical leaders. So thinking about what kind of media you might use for that. And bear in mind that, and I presume this is evident to all of you, but the ways in which all of the kinds of skills and approaches we've been discussing throughout the course come into play here. I mean, most obviously communications, but this has to do with team building because you're trying to bring other stakeholders to it, and community because you're wanting to have a broader community, with integrity because you're going to be taking a stance on something publicly. So this is using all of the skills that we've been talking about for this. Callie, did you have thoughts
Yeah,
about your audiences?
yeah. Thoughts similar to Alicia were threefold. One was at the ministry level. As a matter of fact, I'd just written a letter to convene a violence intervention and prevention immediate response task force to address violence as a public health issue. And this task force would include a criminologist, someone from the National Citizen Security and Justice Program, the National Drug Council, Adolescent Health and Prevention, a mental health nurse, Male Health Initiative, Maternal and Child Health Poverty Reduction, Gender and Family Affairs, and a financial advisor. And they would be responsible to really look at the cases that we've had and identify, doing case studies, they can identify what are the risk and preventive factors and really come up with a more specific plan for those persons who've been impacted. And then at the community level, we really need to identify, we know that the poverty is one of the can be one of the driving factors for violence. And we need to really convene community groups to identify what their concerns are, because they might be crying out. And at the individual level, where you're talking about people at risk, helping them to understand how to reduce their risk of being victims or even perpetrators of violence. So taking it from those three areas. But I think at the governmental level, we really need the political will and to move the financing, because the financing ends up in the police and not the prevention. So it's kind of moving the money to where we can truly intervene at a long term compared to at the end when we've lost lives.
Yeah, so you're in an interesting and delicate situation because
Mhm.
you're a government employee, so you can't be seen to be lobbying the population to lobby other government employees, right? That's a fraught position to be in. So yeah, it seems that your audience is more your peers, right? In other disciplines. We've just submitted a concept note for a grant on positive youth development to combat gang violence by giving youth employment alternatives. And it sounds like this is something that you're actually wanting to substantively move forward with, Kelly, not just as an exercise. Yeah. Um, yeah. So let's be in touch about that. We'd love to help you with that.
Oh, thank you very much.
Yeah. Others.
Hi, good afternoon, everyone.
Hi, Deborah.
Deborah, I my topic I was looking at was to deal with the aggressive marketing of breast milk substitute. You have seen an increase in the marketing of breast milk substitute, especially during the COVID-19 pandemic. And so you have been realized that there's violation of the code, of the international code. And so it has become so much that you're seeing advertising during prime time, during the news, aggressive social media marketing, and all of that. So I wanted to address that because one, because of what is this doing in terms of interfering with the mother's decision to breastfeed, especially exclusive breastfeeding. And we realize that the marketing giants, they're saying, okay, we're not going to bother the baby in the first 11 months, but the the approach they're taking is they have introduced growing up milk and introducing a lot of cereals, even starting from as low as 4 months. And so a lot of the mothers become very confused. It impacts the breastfeeding drive, and we know in the long term it affects the whole NCD strategy that the government has in place. So my thought on it was really to look at the audience of all who's viewing at prime time, but particularly the mothers of babies, pregnant women, and their families. Um, the approach was really to outline the benefits and really both the baby and mother, and see if we can begin to lobby to have that change where you can get some pushback against that aggression that is taking place with the marketing and the confusion that is leaving in the minds of the mothers, that they have to use infant formula even when they don't want to, because they are the way they're advertising is if the composition is important in preventing the babies from, getting ill. And so they tell you what the compositions are that the babies really need. As far as whether I am qualified to do it, I think yes, I am the holder of a MPH. I am the first manager of the National Breastfeeding Coordinating Unit in the Ministry of Health. I am a breastfeeding trainer and a trained assessor and licensed midwife. So I think I have what it takes to
Yeah.
do this.
And that sounds really important, Deborah. And do you think, I mean, it seems to me more like a public health campaign, even more than a letter to the editor. I wonder, I recall seeing billboards and TV ads both.
Yes.
And it's really interesting because what happens then is, I bet that if and when you were to go to those who own and rent the billboards or who provide space for public service announcements, that they'll be very cautious about
Yeah.
giving you space to do that because they're getting revenue. Yeah.
Yeah.
Have
Yeah.
you tried that yet, or are you just sort of saying up front, let's not bother because they're going to be too business conflicted to do the right thing?
What I have done so far is when usually we have an NGO that reports all the violations to us at the ministry, and we would normally write letters. So before we did not have policy. So as of August, we now have a national policy, and the policy speaks a lot about the violation of the code. We do have a, a measure of, we have some legislation because we have an act, but the act only covers um, the labeling, right? As far as labeling and marketing. So the act is limited. So in terms of that, to push to get a little more teeth with the legislation to include, the advertising that is taking place in the open and the billboards, as you say, the supermarket and some of the stores, it's crazy. There are aisles and aisles of infant formula, not just ads, but actual infant formula that a mother could just easy reach. you know. So in writing to them, sometimes you get pushback, and sometimes you will just see the ad come down for a while and it might pop up in another place.
That sounds great. Do other folks have thoughts for Deborah on this, for how they might have taken leadership on this issue? Christopher?
Another possible way you could consider, Deborah, is well, in my experience in the clinics, sometimes these drug reps, they come to the clinic and they would start off speaking to you about random medications that they're offering on formularies, etc. And then they will slip in infant formula. And
Yeah.
I've noticed that trend recently because we've been so aggressive with breastfeeding, advocating for breastfeeding. Um, the drug companies have tried, sliding in breast milk substitutes at the end of discussions. And I think if you target the companies, those marketing companies, a little bit more aggressively, you could probably also explore that way of kind of stamping out, at least in the
Okay.
clinical setting.
Thank you, Christopher.
Anyone else have thoughts on that? These are really exciting and very diverse initiatives. Others want to talk about their pieces and or the sort of meta principle of how this ties into leadership.
Well, I could probably continue.
Good.
So, I mean, while I am a physician, I'm a specialist physician, but I work in community setting. And I try to take a different approach to the letter to the editor. My family has a side hustle, so we would sell cars, used cars, imported used vehicles. And recently, in our country's budget, we tried, well, the government made some amendments to previous decisions with regards to the importation of used vehicles and hybrid vehicles. And I just consider the public health impact on the use of renewable energy for motor vehicles itself. So I just considered using the evidence that based on our current amount of vehicles. So we had some recent research done, and it showed that Trinidad and Tobago had about 800,000 cars on the road, registered vehicles. And we had a population of about 1.4 million people, which is a crazy amount of vehicles for the population size and the road networks. So we had a lot of congestion and so on. So I just basically was considering advocating for the use of renewable energy technology in vehicles as a way to reduce carbon footprints and overall environmental health. And then using that saved financial resources to reinvest into upscale industries that would benefit the public and the public's health. So basically, we would have introduced a host of concessions about almost 10 years ago that would have allowed people to buy hybrid cars or electric vehicles. And that saw a sudden increase in the purchase of those vehicles. But when those persons went to buy those cars, they opted for high-end or luxury versions of a hybrid vehicle. And our government, seeing that, opted to basically stamp out the high-end purchases and instituted a number of control measures. So they limited engine size, they limited the type of vehicle. They even labeled some cars luxury cars and attached a significant tax to them, even though it shows some significant benefit in using a hybrid vehicle on the environment. And by doing so, it kind of crippled the market and it forced people to return to purchasing fossil fuel driven vehicles, which continue to exacerbate the pollution in our environments. So basically, I just used that problem and just tried to show how much benefit could come from switching over, right? And I just kind of highlighted some data from the US where they estimated one car to produce almost 4.6 metric tons of carbon dioxide per year. If we have 800,000 cars, that's a significant impact on the environment. And downsides to that would be the health of our air, the quality of our air, sorry, the health of our population. And what we could do, I suggested that we could probably incentivize a shift towards renewable energy and alternative energy sources for vehicles, and not just alternating the type of fuel, because that's what we've done. We've switched from petrol and we've advocated for the use of CNG, but it still produces a carbon footprint essentially. So towards the end of my statements, I mean, I just continue to kind of try to fluff out why, or, support the cause, and made some suggestions as to how we could also force the migration towards renewable energy sources, possibly by letting the policymakers institute or regulate emissions for vehicles. So we have no emission laws in the country compared to international counterparts like Germany and US and UK. If you have an old car that's about 40 years, you can still drive on the road even if it's smoking. Right? There's no emission laws, and probably considering emission laws and attaching a subsidized motor vehicle tax for better emission vehicle might encourage people to switch over. And also, just putting it at the end, I just said, change is no longer optional at this point. It's a mandate for urgent consideration, because I mean, the health of the environment and the population is in jeopardy.
So
my own, I'll say qualifications to say so, it's kind of limited, just because I might be a race car fan, but still, as part of a business community, it is something that we should consider, not just on the side of business and making a profit, but on the side of the benefits that we could see from a switch.
That's great. It brings up a really interesting point. So I drive a 2005 Prius hybrid, and obviously believe in and was the president of Physicians for Social Responsibility, and I would say those things as my credentials. What does Christopher need to be sure that he does when he writes his letter to the editor? What acknowledgments does he need to make? Christopher, do you know what I'm thinking about here, or?
Not quite sure.
So
Is it a conflict?
it is, yes, absolutely. So do you want to, Christopher, do you have a sense of how you might deal with that conflict? And do you get what at least Callie and I think the conflict might be?
I'm not too certain.
Okay, well, for me, I think that you need to disclose that you, and this is what one does with conflicts most readily, right? That I'm writing this as a doc with expertise in public health. And I'm also writing this as someone with maybe you could describe it more dignifiedly than a side hustle in doing this, right? But someone with a commercial interest in doing this as well, right? And that's fine for you to, I mean, you were motivated to go into this commercially, presumably A, because it could be a decent business, but B, because it was something that resonated with you ethically, it sounds like. It's fine for you to have both of those hats. You just need to make sure that you acknowledge them in your self-description. Often, customarily even with letters to the editor, there'll be a little 10, 20 word blurb about the author. And so in that, you would say, I'm a doc and an importer of EVs, right? Or however you'd want to put it, right? Sorry, whoever is calling in on the Galaxy S8, you're audible, but only barely. Okay, evidently unintentionally audible then. Callie, was that the conflict that you were noting as well, or was there something else you wanted to bring up?
No, that was
Okay, great.
on point.
So everybody gets nothing wrong with Christopher talking about this. Fantastic. Yes, there's a conflict. Yes, you just need to acknowledge that and you're good.
Yeah, no, you need.
Monique, did you want to add something there or?
Yeah, sorry, I was about to say the same
Please.
thing that there might be a question of his credibility if he didn't say it. Yeah, so I
Yeah.
had the same thought.
Yeah, good. Excellent. All right, others?
I can talk about my idea.
Please, Monique.
Good afternoon again. My idea is we have a challenge, I guess, not only here in the Bahamas, but I guess in the region as well, with a lot of lower extremity amputations in persons who are diabetic. And so here and around the world, those numbers have been increasing. And in fact, all of the changes that we made for COVID-19 has actually increased those numbers, because early on in the process of COVID, we closed hospitals, closed specialty clinics, closed a lot of places. And so persons with diabetic foot problems, complications, were not able to access care. And so they ended up with in hospital where they may have gotten COVID, or they ended up with amputation, or they did not seek care, and then they also ended up with bad outcomes. So my idea was I wasn't thinking of it quite as a hook, but I was thinking of an idea to say about how COVID contributed to increasing this problem or worsening the problem. But also what I wanted to bring up was that, even before COVID, this was a problem because diabetic foot and amputations that's not a sexy area. So is an area that does not get the play, even though the outcome is very, very, very bad, and so I was thinking of, we have a lot of data on it locally and regionally and globally, and I was thinking of using that. But now as I listen to you, I'm like, I don't know how I would cover it to the editor, in terms of, because I really was thinking um who would be the target audience, and I think it would be more than one. It would be the health professionals, definitely. I would like to impact the persons, the diabetics, or the persons their loved ones, lay people. And then so I'm not 100% sure of how I would have to get that message out. Maybe I would also need to write two different groups like that.
Yeah, another cohort is in some countries there are patient groups or societies devoted to supporting patients and research on a particular topic, like the American Diabetes Association, for example, and there are state branches too. Publishing something like this as a blog in such an outlet, such a medium, could be useful potentially. I'd encourage you to, for your peer here, might be good for you to work with Alicia, since she's thinking about a similar kind of nexus between how does COVID affect NCD and vice versa, right? Um, you guys might have some good thoughts for each other, but I would think that could be a useful cohort of readers for such. Anybody else have other ideas for populations that could be useful for Monique?
Hey,
Hi,
good night. This is Roxanne from Bermuda.
hi, Roxanne.
Hi. Yes, I had two ideas. I'm sort of toying between the two. The first one, which is a country debate at the moment, is the wearing of masks. We've had the last few weeks in this country, we have had all sorts of lawyers and top people saying, it's stripping of people's rights in terms of wearing a mask. So that's become a debate. And there's even some type of march and protest tomorrow at our city hall. So I wanted to look at all of the research behind a mask and how that has assisted us with keeping our numbers low. Here in Bermuda, our numbers have been really low. We've been sort of spotted as the destination to come to be safe. However, that's all taken a real U-turn in the last 2 weeks. And we've probably had almost 40, 60 new cases in a week, which is unheard of. We were at 53 for a long time. So that's one idea I had as a public health official, to send my support behind what we are trying to do here at the ministry and in public health to try and, flatten COVID. My second idea, completely non-COVID, because I am COVID out, is about our high incidence we have in this country of road fatalities in our young population and in our young adults in riding mopeds. And most of the accidents have occurred as a result of alcohol. So I wanted to marry the two and address that. I think the country needs to get a bit more cohesive in its approach to tackling it. We have several entities, but we don't have one big voice to tackle the problem of alcohol use in the young people, but also the fact that they are driving under the influence. And it seems to be every year almost expected and anticipated that we'll have, between 12 to 14 deaths. And to some countries, that's not probably a lot, but with a small population of 60,000, and these are young people, it's quite frightening. So those are the two ideas that I'm toying
Yeah.
around with at
So-
the moment.
Yeah, so those bring up really good examples of hooks. So, and it's somewhat grotesque to talk about it this way, but your local media are going to want to have a public health person in the next couple days who will write a letter to the editor about masks, because they're going to be covering these protests. It's going to be a big deal. And this is a time that you can get heard. So if you were to contact a couple of media outlets where you already have connections, I think that this would be something that, and say, would you like to have a letter to the editor about this? I bet that they'd jump on it, particularly if you can contextualize it around the protests. And sadly, similarly, and I hate to say it, but yeah, given the inevitability of having more mortality from drunken mopeding by young people, I would encourage you to have such an editorial ready for the next time that there's a high profile case. And then the media that you worked with in this case you can contact them. You can even talk to them ahead of time and say, when this tragically happens, I'd love to give you some thoughts on it then as well. That could, making sure that you have, audiences that are going to want to publish and want to read this is of the essence. So Those
Okay.
both sound really important, and I'd cue them in that order.
Thank you so much for
Yeah,
that
of
input. I
course.
appreciate it.
Good. Maybe time for one more?
This is Maria from Trinidad. I had some concerns. I was toying around with the idea and that I found out how many of our private pharmacies, and I'm not sure how to really address this, but they sometimes dispense medications that are supposed to be prescribed without a prescription. And this will also include like herbal medicines that have not been properly undergone the proper trials and so forth. And I think that how, I don't know if my other colleagues would have experienced this in their countries, but it's very unregulated. And remember, it's the proper investigations and history and examination of the patient are not done. And I've had patients coming into the health centers with an allergic reaction because they bought some antibiotic over the counter that was for a condition that was not properly diagnosed. And I just observed that how with time that I don't know what the regulatory procedures are in terms of looking at this. So that was my concern that I was considering to write about.
Yeah, and this is a really nice example of something where um, if you were just Maria, anybody else, your alternative would be writing a letter to the editor, but you're in the system. You are the system, right? And you have, it sounds like this is something where you'd want to work with legislators, that this might even be something that could come from your department saying, we've noted this. This is, it seems to me, maybe others have different notions, but it seems to me that this is a problem with a legislative remedy, and that the appropriate way for you to go as a public servant is to approach the legislature officially. Maybe folks who are particularly interested in or have obviously responsibilities for these kinds of issues would seem to me to be the appropriate way, writing a letter to Parliament kind of thing.
Yeah. Yes, that's a very good. I didn't actually think about a letter to Parliament as an approach, and I think it would have a lot more impact if I used it from that direction, as opposed just to a letter to the editor. Thank
Yeah,
you
I
for that
mean, it
input.
would, like, imagine being a layperson and reading this letter to the editor from you and saying, hey, these people are supposed to be taking care of this for me. They're not supposed to be asking me to take care of this, right? Yeah, I think I would think that that might be the first way to go, given the fortune of your position.
Thank you very much.
Yeah. And of course, doing it in partnership with your supervisor, right? If you're going to be approaching the legislature, because I know from working with CDC that there are all sorts of nuances about how to do that in the States if you're approaching a legislature as a government employee. So I'm sure you'll follow appropriate protocol there.
Yeah, of course, because I know my supervisor will guide me correctly.
Super. Wonderful. All right. Well, we're almost at the end of our time for today. After next week's class, which will be our last and which I'll tell you about in a moment, I'm happy to hang out and talk to folks about their letters to the editor, also to do follow-ups by email between now and then or after then as well. We would like to have everything done for the course before Christmas in order to be able to give out your certificates as a Christmas present is or Boxing Day or soon thereafter. So if I'll talk about that some more next week. Next week is going to be the discussion that I had promised you on community. As you'll recall, last week we switched the two discussions on community. Rajan talked to us about community from a high level perspective. And next week, my colleague, my Stanford epidemiologist colleague who trained me in my fellowship there, she's going to be talking about one of the first large scale interventions that was done on NCD prevention, the Stanford 5-City Project, and where there were successes and failures, and where there was the need for bold and courageous leadership, and how that has really informed many of the NCD interventions that we're doing now. So I think that will be quite stimulating for our last time. And I'll give you some more wrapping up kinds of instructions then as well. I think that's it for this week. We'll be in touch in the next few days with instructions for everyone. Really excited to hear about your letters to the editor. I know that you all came in with much of this baked in already, but it's lovely seeing these clear manifestations of leadership on issues that you've identified as important and requiring addressing, and seeing you using all of these skills to address them. It's really gratifying. Thank you, everyone. See you next week then.
Thank you very much. Have a great weekend.
Thank you very much. Have a great
Bye.
weekend.
Yes.
Bye-bye.
Bye.
Bye, everyone.
Bye, everyone.
Bye, everyone.